They often have a heightened emotional response. The effects of trauma can actually be long-term, sometimes even permanent. Hi, this is Jim Breon. Welcome to this YouTube channel where we discuss all things mental health. If the videos are helpful to you, I encourage you to like and subscribe and sign up for notifications so we can let you know when there's more content coming out. What I was going to talk about today is something called complex trauma, sometimes referred to as CPTSD. And people have asked me, what's the difference between that and PTSD, and what is complex trauma? You know, when it comes to understanding trauma, what happens when somebody is traumatized is an event or a series of events overwhelms the person's ability to cope with it in that particular moment. And what's traumatizing for one person is not necessarily going to be traumatizing on the same level for another person. And it's because of lots of different individual differences, temperament, personality, the way our nervous systems are developed. What happens with complex trauma is people are exposed to chronic or long-term or ongoing stressors and traumatizing events, as opposed to what we think of as PTSD, which is generally caused by what we think of as shock trauma. When we think of PTSD, I think people think of things like maybe having a car accident or a violent assault, or maybe something that happens to veterans coming back from a war situation. And the difference with complex trauma is that it's not one single event, but it's a series of events that can create a complex traumatic experience in people. And a lot of times these complex trauma events, they often happen in childhood. Can come from childhood neglect or abuse. Not necessarily in childhood, though. It can happen to somebody of any age, really. When there is prolonged domestic violence, or people living in a war situation, or even long-term community violence, oppression, racism, living in political instability, and even regular exposure to danger can actually lead to complex trauma. Another component that can lead to complex trauma is family dysfunction, including living in an enmeshed environment, or something where children are parentified. Maybe there's one of the parents is an addict or an alcoholic, or has a personality disorder or some severe mental illness. That can lead to what we think of as complex trauma as well. Now, with PTSD and CPTSD, they both have the same core symptoms, including anxiety, flashbacks, or re-experiencing events that have happened in the past. Often people have nightmares, and they will avoid situations or people or places that are related somehow to the traumatic events. So there's a lot of avoidance behaviors. They often have a heightened emotional response. They can be very impulsive, sometimes even aggressive. And they experience something we think of as hypervigilance. In other words, some part of their nervous system is always on alert, waiting for the next thing that's going to happen that they have to respond to. And what is difficult about this is often people have a very difficult time ever feeling relaxed and calm and safe. They can have persistent negative thoughts and negative emotions. Now, some of the differences between PTSD and complex trauma is that with CPTSD, complex trauma, there can also be an element of emotional and affect dysregulation. What that means is that people can have a hard time just basically regulating their emotions, coping with their emotions as they arise, and sometimes can lead to aggression. And often people really struggle with deep feelings of guilt and shame. And then there's an identity disturbance. In other words, they can have a hard time actually knowing who they are, having a sense of self. And it can be very difficult for many people to maintain meaningful long-term relationships. So that emotion dysregulation piece, to many people, you hear that and you might even think that sounds like borderline personality disorder. And that is a similarity between complex trauma and borderline features. Yet they're different disorders. There are some similarities like the impulsivity, problems maintaining relationships, and maybe even feelings of worthlessness. Some of the differences are that complex trauma is caused by traumatic events, and that's not necessarily so with borderline personality. There's often a very strong correlation to childhood trauma, including abandonment, but trauma does not have to be part of the diagnosis for borderline features. Also, borderline traits generally develop in early adulthood, whereas CPTSD can develop at any point in time. And when we look at what happens when somebody is experiencing this type of trauma, it actually affects the brain. And the effects of trauma can actually be long-term, sometimes even permanent. Trauma affects the brain mainly in three areas. The amygdala, which is a small part of the brain in the limbic system that regulates fear, anxiety, also the fight-flight mechanism, and really our emotion mind. Also in the prefrontal cortex, where we have our executive functions, and where we can make long-term plans and make rational decisions and linear thinking. And then an area called the hippocampus, which is involved in learning and consolidating memory. And some of these changes in the brain can actually be more severe and more long-lasting with complex trauma than what we think of as post-traumatic stress disorder. Now, there is treatment, psychotherapy, including trauma-focused cognitive behavioral therapies recommended. Often EMDR can be very helpful for helping people resolve the symptoms of complex trauma. Exposure therapy, as might be done with obsessive compulsive disorder, and various somatic therapies, even internal family systems. And actually things like practicing yoga and qigong can be very, very helpful for people to learn to connect to their bodies in healthier ways. Sometimes medication is part of the treatment plan, although it doesn't directly address the trauma, but it can help with anxiety, depression, and when people have hard time sleeping. The goals in trauma recovery therapy is really to help people learn how the body responds to stress, how it responds to trauma, and how to manage those symptoms, how to connect with the body more mindfully, and also identifying unhealthy thought patterns and restructuring their cognitions and reducing the avoidant behaviors so that there can be an increase in the ability of people to function and to cope. I hope the video is helpful. If so, as I say, sign up for notifications so we can let you know when more material is coming out. And let us know what you think in the comments. If you have questions or comments, feel free to leave something down there, and I do take a look at those, and let's keep the conversations going. Until next time, take care of yourselves.